Okay. We are having a little bit of issue today with our connection. So if I happen to need to reconnect, you guys you look for me, I'll come back on. We have this problem from time to time. We thought we had it resolved, but we've already had a few issues. So I am Dr. Polly Heil-Mealey with Abundant Health and Wellness, and we are going to do our lunch and learn today on how to revitalize your skin and to see if your skin, see what's happening with your skin so you know what the age of your skin is. So let's see if I can actually read some things, maybe not. I've got my big computer here so that I can kind of see where we are. Thanks, Ray. Thanks, Julia. Appreciate you guys being on. Hi, Monica. Monica, I have your earrings. We sent you a phone message, so just letting you know that I've got them at the front desk for you. So I just wanted to give you that shout out. So we are at Abundant Health and Wellness, and we are downtown Humble on Avenue C and Main Street. So today I want to talk to you about what you can do for your skin. So we all want to have pretty skin. We all want to have young skin. Men, if you're watching, and I know a lot of men do watch because I get comments from you, you want to have pretty skin as well. And so what we want to do is talk about some of the things that happen to our skin as we age and what we can do to actually help that. So I am looking at a report, and the report says Forever Young with Skin Renewal. And this is a report by a friend of mine, Dr. Dickie Fuller Looney, that's her name. She runs a company called Transformations, and we have a lot of their products, and this is her report on how to keep your skin young. Now, she is well into her 70s, and she looks absolutely beautiful. I've seen her up close and personal, and so if you Google her, you'll be able to see her as well. So she obviously does practice what she preaches. So one of the things that I want to show you right now is how you can tell if your skin is healthy. So take your back of your hand, and you're going to do the pinch test, and you're going to hold it, and you're going to pinch it for 2 or 3 seconds. Of course, you can see I'm pinching, and then you let it go. So you want to see how fast your hand reverts to the pre-pinch position, PPP, pre-pinch position. So if your skin returns to your pre-pinched position in under 5 seconds, and your skin is younger than 50, and mine did. Mine doesn't hold at all, so that's a good thing. Now, this is a test that we test for hydration as well. And so if you're dehydrated, your skin is going to be just a little bit more thin and more aged. We're not like cheese, we're not like wine, we don't want our skin to age. So if your skin, you need to hold it for 5 seconds. If it returns to normal in less than 5 seconds, then the biological age of your skin is under 50. If it takes 10 to 15 seconds, then your skin is aged 60 to 69. If it takes time that exceeds 15 seconds, then the biological age of your skin is 70 or more. So if you're 70, then that's one thing. But if you're younger than that, then you want your skin to be younger. Even if you're 70, you want your skin to be younger. My mom is 80, and her skin is beautiful. And so if you've ever seen my mom, you know that she is very, very young looking. So what happens to skin? How does skin lose its elasticity? So it needs good skin, needs circulation, and it also needs protein. So if you are a vegetarian out there, you're going to have trouble with your skin because your skin needs protein in order to rejuvenate, and it also needs good circulatory system and a good blood supply. So this is what it says. Deficiencies in the tissues, right, cause muscles, nerve fibers, and blood vessels to become rigid. These are responsible for the loss of muscle tone and skin elasticity, resulting in sagging and drooping skin and muscles. Now, I had a lady in here this week who wants me to buy into her skincare line and all that kind of stuff, and I'm real careful what I do. Just in full disclosure, I've worn Mary Kay since I was, well, let's see, Hillary was 1 year old, and she is 34. So 33 years I've worn Mary Kay almost exclusively, so I'm just going to throw that out there. I have used, in the past 5 years, I have used Dr. Julia T. Hunter's skin therapy, which is amazing. It's extremely expensive. It's intensive in that you've got all these little bottles and you've got to do this step, that step, the other step. I'm kind of a one-step wonder on that. And so that's what I do for my skin. But there's all these other companies out there that want to be in our clinic because we are holistic, and they claim that they're holistic. And I had a meeting with a lady this week who was trying to sell me on some skincare line. Not really interested in doing that, although she does have a repair product that has polypeptides in them that apparently, according to her, give you the same results as Botox does, but without the harmful bacteria. Now, I don't know about you if you do Botox or not. I don't do Botox, and I'll tell you why. Botox is the botulinum bacteria. I can't remember the exact name of it. But you know, when you were in home ec, when you were in high school, and they said don't buy the dented cans in the grocery store because they have that botulism bacteria in there. Well, that is exactly what they are putting under your skin, and it can cause nerve damage. It also causes no wrinkling of the forehead and that kind of thing, which is why people do it. But we've seen it where the eye has drooped, we've seen it where the mouth is drooped, and so for that reason, I just don't think it's very holistic to be putting a poison under your skin. But this lady says that you can use this repair set, and it actually does what Botox will do without the harmful bacteria. So if you want to have any information on that, reach out and I'll give you that information. I'll give you her number. We don't carry it in the clinic. I haven't tried it. I've got too much other stuff that I need to use before I try it, so I'm just kind of throwing that out there. So we don't want droopy skin, and we can reverse that with enzyme therapy. Now, what is enzyme therapy? Enzymes are chemical catalysts that your body uses in order to provide the functions that it needs to perform. So we get our enzymes from our amino acids. Our amino acids are primarily found in our protein. Now, we've done several broadcasts on this. We've done several webinars and all that on the myths of vegetarianism. A lot of people out there are vegetarians, and that's okay if you want to do that. You're not getting complete protein. So if you don't have complete proteins, you're not going to have all of your amino acids. If you don't have all of your amino acids, you're not going to be able to make all of your enzymes, because enzymes are made from your amino acids, and you get that amino acid in your food supply. So just going to put that out there so anybody think about what you're eating. You need a lot of protein in order to have the enzymes, because it's the enzymes that repair the skin. And so that's what we want to do. So physical regeneration is characterized, right, by inflammation, gradual thickening or hardening of the mucus and submucosal lining. So we don't want to have that physical degeneration. This is part of aging. This is a natural part of aging. If you don't do anything about it, it's still, you know, you're going to have what you have, but you can do some things about it. The increased level of hardening chokes arterial circulation, which leads to hardening of the arteries, cuts off your oxygen and your food supply. So the tissue clump and breakdown gives you the skin disorders. Skin problems can be skin eruptions like molds, liver spots, calloused feet, and other dead cell accumulation. Now, Fortunately, on my face, I don't have any liver spots, but I do have 1 or 2 on my arm, and so I'm going to be looking at some different therapies that I can do, because this shows, they're called liver spots for a reason. Even though I take good care of my liver, I have 1 or 2 spots, and it may just be age-related, but it's something that I want to take care of. So enzyme therapy. Enzyme therapy relates to health. If you don't have the right enzymes, you're not going to have the right chemicals going on in your body so that you can repair damaged skin. So enzymes work in healthy digestion, freeing up the nutrients from our food that are the building blocks of glowing skin. Enzymes are the powerhouse behind efficient blood flow and circulation, so you need that. Enzymes are responsible for reducing the various unsightly signs of detoxification that come through the skin. Enzymes slow the aging process, all right? It is evidenced by sagging and wrinkled skin. So we don't want to have sags, we don't want to have wrinkles, okay? So rejuvenation has to come from within. So what you put on your face is important, but if you really want to reverse the signs of aging, then you need to go internally as well. So your skin's underlayer is called your dermis. Okay, it is made up of collagen. Collagen is a protein. So if you're a vegetarian or if you're a vegan, you may not be having the right kinds of protein to make the collagen. Collagen extracts the nutrients it needs from the blood. So you've got to have that in order to get what you need. The outer layer of the skin, the epidermis, is not nourished from within. Oh, my lights are going out. My eye doesn't see me. Sorry about that. So the blood, the epidermis, that is the top layer of your skin, does not get the nutrients that it needs from your blood. So that's why you put on the topicals and that kind of thing. Now I'll just tell you, a real cheap topical that you can do is something called castor oil. We've got it here in the clinic. It's organic. You put that on your skin, you sleep in it, and you wake up and your wrinkles are pretty much non-existent. They're really, really good. Now it's sticky, so you might not like that. It's not perfumed. You might not like that. It's just pure organic castor oil. I've used it from time to time, and I can tell a definite difference in the wrinkles when I wake up in the morning. You can tell by looking here. I did not do that last night, so I need to do that. Okay, so your skin needs fats, proteins, and carbohydrates to remain healthy and vibrant, and that's what we want. This is why digestive enzymes play a vital role in skin upkeep. Enzymes determine which nutrients will be available for skin nourishment. Now, I want to just read you this testimony, right? At the age of 60, Carl called on me because his gums were bleeding and his front tooth was loose. He had high hopes that enzyme therapy could help with his periodontal problems. A high-dose regimen of protease cleaned up the swollen and inflamed gums and saved the tooth. So protease, and I have one here. This is protease. Protease is an enzyme that breaks down protein. It's got bromelain in it. Bromelain you can get from your pineapple. But anyway, protease is what she gave him. So protease is a really good anti-inflammatory. It's really good for pain control. And so the teeth were very inflamed. The tooth was loose. So she gave this to him for his gum disease. I said tooth was inflamed. The gums. Y'all bear with me here. So he says that Carl noticed an unexpected bonus from this daily intake of enzyme supplementation. He looked 20 years younger. Well, I will do whatever it takes to look 20 years younger. How about you guys, right? So it said that his skin looked smooth and soft. It had lost its wrinkled and hardened appearance. Even the color was youthful. Carl phoned me one day to tell me that people were constantly telling him he looked great. Everyone wanted to know his secret. He said, I'm tempted to keep the secret, but no one believes me anyway when I tell them I just take digestive enzymes. Now, you're going to, enzymes, you take them 2 different ways. You take them with your food to metabolize the nutrients that you're eating, but you take them between meals to do other things. So there's two different ways that you take these enzymes. So when we get older and we've had the sad American diet, right? We've eaten that standard American diet, SAD. We've eaten that all of our lives because we didn't know any different, or we didn't care, or nobody ever told us, right? So we've used up, most of us have used up all of our pancreatic enzymes by the time we're 30, okay? So that's something that we want to make sure that we are able to understand, because we don't want that to happen. So digestive enzymes and deficiencies, okay? Many health food contain their own supply of digestive enzymes, but when you cook food at temperatures above 118, so if you do any boiling, certainly if you do any microwaving, you're killing all the enzymes in your food, and so they become dead food. Dead foods are devoid of enzymes. So if you're eating primarily a cooked diet, you need to have digestive enzymes with your food in order to metabolize your food and give your body the enzymes that it needs. So secondly, not only are many of our food choices lacking enzymes because they're processed, they're also lacking in nutrition, which places an even greater demand on the digestive system. Our genetic programming, which determines our body type, can also cause us to have difficulty with digestion of certain foods. When the body is lacking enzymes for any reason, you see it in the skin. So when you're looking at people and their skin looks yellow, you're looking at people and their skin just doesn't have that nice youthful glow, then it's because they don't have the enzymes or the catalyst that they need in order to do what it needs to do. So the protease breaks down the protein in the diet to make it readily available for the cells. Without enough protease, the skin literally starves, and this is why when we get older we get wrinkles, because we don't have the right enzymes. So we need to understand that we've got to have those enzymes. So if you have any kind of skin issue, psoriasis, rosacea, eczema, all those kind of things, all of those are related to enzyme deficiency. I think rosacea is parasitic. I'm just going to throw that out there. I know psoriasis is a fungal pattern. So if you have psoriasis, then we've got fungus issues that have to be dealt with. I know people that have had psoriasis all their life, and the doctor says, yes, you're going to always have this, but we've been able actually to give them different remedies, and we've seen that psoriasis just goes away without the harmful biologics that the doctor wants to give you for psoriasis. You see the ads on the TV all the time, and so we don't want that because they hurt your immune system, so we don't want to do that. So part of a skin issue, remember the liver takes care of the skin. So if your skin is showing issues, that means that your liver is not doing what it needs to do to detoxify the body. So there's a lot of things that we can do to help with that. If we've got invaders in the body, we've got environmental toxins, we've got food toxins, we've got parasites, we've got fungus. These all run through the body on an endless search and destroy mission. So Dr. Fuller says the pollutants we breathe, the hormones and the antibiotics we get in our meals, the pesticides that we consume on our vegetables, the bacteria, the fungi, and the parasites to which we are exposed are just a few of the toxins that need to be taken care of and must get out of the system. So along with the kidney, the bowel, and the lungs, the skin is used by the body for detoxification. In fact, the skin is your largest organ in the body. So I know from time to time that I'll get little rough patches on my elbows, and I think it's because I sit like this all the time with my elbows on a hard table. But I've noticed that if I nourish my skin with essential oil therapies, and we know we have the bear oils. You guys know we have that. We've got bear oil hand cream. We've got bear oil body lotion that doesn't have any of the phthalates, the parabens, or the sodium lauryl sulfate, so they're very, very good for the skin. Remember, the epidermis has to have something topically, but the wrinkles are because the dermis is not getting all that it needs from within. So it's a two-step program, so we need to look at that. So with the enzymes reduce damage to the skin by the toxins. The enzymes support the repair of cells that is impaired by the free radicals. Enzymes are the only substance in the body that can rebuild an injured cell by infusing them with oxygen and fortifying nutrients. So this is the thing. If you want to look pretty, if you want to look young, then you're going to have to work from the inside out and nourish from the inside out. Now, I just want to tell you a few little hints here. If you have acne, acne is because of poor digestion of fats. If you have eczema, poor digestion of sugars. If you have poor digestion of sugars, then you're going to have a fungal load, and so it's going to be a fungus at the back of that. Psoriasis is poor digestion of proteins, but also that leads to a nutrient supply for fungus, for yeast, and all those kind of things, so we don't want to have that. Pimples and blackheads is just pure toxicity the body's trying to push out. Lipomas are rancid fats. Okay, so no one wants to talk about lipomas. What are lipomas? Lipomas are really hard fat balls under your skin. You can have them on your arms, you can have them on your chest. I haven't really seen them on your face, but I have seen them on the torso and the arms, and they're really, really disfiguring, and they're embarrassing, but that's rancid fats. Cellulite, we all know what cellulite looks like, and that's toxicity trapped in the fat. And then wrinkled skin is a sign of overall toxicity and poor digestion. Okay, so we need to look at all of that. So the protein connection, let's talk about that. The protein connection. Specialized proteins fed by protease maintain the integrity of the supporting tissue and furnish normal elasticity for the skin. We want our skin to be elastic. We don't want it to be frozen by Botox. We don't want it to be droopy and saggy and all that kind of thing. And so if you have the protease, then that's going to help you. The interlocking of elastin, of course we know elastin sounds like elastic, right? Elastic keeps things really nice and tight, and that's what we want with our skin. So elastin is a yellow fibrous protein that is the basic constituent of connective tissue, and collagen is in the layers of the skin that keep it smooth and supple. As we age, the system hardens, and that's why you get the wrinkles. The aging process is arrested when there is adequate supply of enzymes to feed the skin and deliver the supplies of oxygen that keep the cells pumped up and allow them to replenish. So a couple of weeks ago when we were doing our Facebook Live, I kind of walked you into the other room where we had the oxygen chair. Now the oxygen chair gives you 3 times the oxygen that you're going to get when you're doing your normal breathing. An atmosphere, which is what they call the air, it is the atmosphere. The atmosphere in my office is 20% oxygen, 80% other gases, hydrogen, nitrogen, carbon dioxide, whatever. On the O2 chair, we have a device, and that I showed you, you get 3 times the oxygen. So instead of just breathing 20% oxygen, you're breathing 60% oxygen. So that's 3 times the oxygen. So your skin is going to be nourished. Your skin is going to be energized. So that's another therapy that we have here in the clinic that you can take advantage of. The protease also improves your circulation. I've met many people in the last few weeks that are having vein disease, which causes their circulation to be impaired. So the protease brings oxygen to the blood. It helps the circulatory issues so that your skin, your dermis, underneath the top part of your skin, has the oxygen and the blood supply and the nutrient supply to work on the regeneration. So it says, protease enzymes are the life source of the circulatory system and its blood. Protease keeps the blood moving by cleaning up the congestion and the red blood cells that stick it together in clumps. Now remember, we're talking about doing live blood cell analysis here. You can probably see my microscope behind me. Not doing it professionally yet. I'm just playing around. So if you want to come in and let me practice on you, then call the office and we'll kind of schedule that in when I can. But what we see, one of the things that we see is blood cells, red blood cells, that's all clumped together. And Dr. Dickey says that when you do protease therapy, in just one dose, that they can see microscopically that it immediately loosens. So I would say you take your protease, and then within an hour, we take your blood, we look at it, and an hour later, after you've taken the protease, we look at it again. And she says that the clumping and the stickiness of the red blood cells is totally alleviated because you've got that protease in there. So that is something that we can actually look at here in the clinic and kind of test that out. So because the body is composed of protein, protease feeds and fortifies the cells of the blood itself, making it stronger and better equipped for the task of distributing the nutrients. Now, foods for your skin, all right? These are foods you need. Fresh, organic vegetables, red and green peppers, broccoli, tomatoes, cucumbers, kale, and squash, to name a few. Fresh, organic fruits, apples, oranges, grapes, melons, berries, pineapple, and bananas. Healthy fats, avocados, almonds, walnuts, Brazil nuts, flaxseed, pumpkin and sunflower seeds, olive oil, and cold water fish such as salmon. You can also get a really good omega supplement, something that's really, really good. If you have fish oil in your cabinet, I want you to put it in the freezer. If it comes out, put it in the freezer overnight. If it comes out cloudy, it's got mercury in it, so I don't want you using that, okay? Clean protein, so that's beef, poultry, that's organic, grass-fed, hormone and antibiotic free, and then water, okay? So I just want to go over a few of the products that we have. Protease, I would do this between meals, because between meals it's going to act as a proteolytic enzyme, not necessarily a digestive enzyme. If you want to do it with digestion, that's fine, but you also want to do it between as well. We've got another product. We've got several products. I just brought one in. This is the same company, Transformations. It does have protease in it, but it's got other kind of enzymes in it for food digestion. So you would take this with the meal. You would take this on an empty stomach. We also have, if you've got really, really topical things, we've got a homeopathic cream called Rosacea Relief, and we have seen that it really, really helps calm down the rosacea. You put it on your skin a couple times a day, and it's non-greasy. It goes right in. It's homeopathic. It's very, very good. It's all organic. There's nothing in here that you wouldn't want. And then we've got this, which is an eczema and psoriasis relief homeopathic salve. Now, I will just tell you, this I have seen work on both eczema and psoriasis, but I will tell you, if you clean up your gut, if you clean up the gut, you will have long-lasting alleviation of that psoriasis. So, or eczema, it's all coming from the inside. It's not on the outside. So this will help with the outside, but you've got to clean up the inside. We've got a protocol here in the clinic that is called Thrive in 63. Dr. Dickey developed that. I've been friends with her for about 2 years, and I went to their conference last spring, and learn just a lot about their products and a lot about what they're doing. The thing I like about their products is they're not expensive. They're very, very good quality, and they're just not expensive. So that's something that a lot of people don't want to do, holistic therapies, because they think they're expensive. The Digest is $54 for a month's supply, and then the Protease is $37 for a month's supply. So you can look at it and, what is your health worth? Some of these creams and that kind of thing that I've seen, even the lady that came to show me that line, their whole skincare for 2 months was about $600. So, it's topical. It's not going to do anything from the inside out. It may help. I'm interested to kind of see what that repair with the Botox-like ingredient is that's not Botox. I'm kind of interested to see what that's like. But I haven't invested in that yet, and we don't carry it here at the clinic, so I'm just going to throw that out there. We might. Like I say, if you want to try that, I'll let you have her information. I'll certainly refer you. But what I'm saying is you can spend $600 on things that are going to work on you topically, or you can spend $50 on things that are going to work on you internally, and you're going to have a much better outcome. So trying to dispel all the hype, because we get all these different things on social media and people that we know and all that kind of thing. And you don't know if it's true. You don't know if it's not true. There's some things that I can see through and I can say, oh yeah, I know that's a scam. There's some things that's like, well, I don't know, and I need to check it out. So that's why I'm here. If you have any comments, questions, pop them in the box and we'll get back to you. It's almost 12:30 according to my clock. So I'm going to say goodbye. It's the weekend. It looks like it's going to be a dry weekend, so it's probably going to be humid because the ground is very saturated. So take care of yourself. It is actually Hydration Day, National Hydration Day. Trish told me that this morning, so I wanted to make mention of that. If you are outside, if you work outside, you're in this heat, you're in this humidity, you need to drink, drink, drink. And we've got, remember, the Spectralite, which is your electrolytes, and Rehydrate, which makes your water wetter. We have all of those products here at the clinic that are going to help you stay hydrated in these hot dog days of summer. So I'm going to say goodbye. It's the weekend. Enjoy your week, and I will see you again on next Friday for our Lunch and Learn. Take care. Talk to you soon. Bye-bye.